Welcome to the complete GLP-1 deep dive. If you've watched our main GLP-1 breakthrough video, you're ready for comprehensive information covering every aspect of GLP-1 deficiency from causes to complete recovery. We'll explore 10 detailed areas with the latest medical research and practical guidance for lasting wellness. Progression and health impact. Without treatment, GLP-1 deficiency typically follows a progressive pattern that can significantly impact overall health and quality of life. Initially, symptoms may be subtle glucose intolerance and gradual weight gain, but they often expand to affect cardiovascular, renal, and neurological systems over time. The condition can evolve from mild insulin resistance to full metabolic syndrome that permeates multiple organ systems and dramatically reduces life expectancy. The systemic health impact extends far beyond blood sugar control, as GLP-1 deficiency triggers chronic inflammatory activation throughout the body. This sustained metabolic dysfunction can contribute to accelerated atherosclerosis, increased cardiovascular disease risk by 50 to 70%, and progressive kidney damage. GLP-1 deficiency increases the risk for heart disease, stroke, kidney failure, and premature death by up to 10 years, making early intervention crucial for preventing these life-threatening complications. However, understanding progression also reveals hope for intervention at any stage. Even long-standing GLP-1 deficiency responds well to treatment, and the body's healing mechanisms allow for significant improvement regardless of how long symptoms have persisted. Modern treatments can interrupt the progression and often reverse many of the negative impacts, restoring normal metabolic functioning and well-being within 6 to 12 months of beginning appropriate care. Underlying causes and risk factors. GLP-1 deficiency results from a complex interplay of genetic, environmental, and lifestyle factors, with no single cause responsible for development. Genetic predisposition plays a significant role, with family history of diabetes or obesity increasing risk by 2 to 5 times. But having risk factors does not guarantee developing the condition. Gut microbiome dysfunction differences, particularly involving beneficial bacteria that stimulate GLP-1 production, contribute to increased metabolic dysfunction sensitivity. Environmental factors include ultra-processed food consumption, which suppresses natural GLP-1 secretion, sedentary lifestyle reducing insulin sensitivity, chronic stress elevating cortisol levels, and poor sleep quality disrupting hormonal balance. People who have experienced significant weight cycling or restrictive dieting are more likely to develop GLP-1 deficiency. However, many people with these risk factors never develop severe deficiency, while others with fewer risk factors do, emphasizing the individual nature of the condition. Lifestyle factors encompass high sugar and refined carbohydrate intake, overwhelming natural GLP-1 response, inadequate protein consumption reducing satiety signals, insufficient fiber intake limiting beneficial gut bacteria, and irregular meal timing disrupting natural hormone rhythms. Physical health conditions including polycystic ovary syndrome, fatty liver disease, and chronic inflammation can also trigger or worsen GLP-1 deficiency symptoms. Understanding these multifaceted causes helps eliminate self-blame and emphasizes that GLP-1 deficiency is a legitimate medical condition requiring professional treatment. Diagnosis and assessment. Professional diagnosis involves a comprehensive evaluation that considers symptoms, laboratory results, and functional impairment in daily life. Endocrinologists and primary care providers use standardized diagnostic criteria and assessment tools to ensure accurate identification and rule out other conditions with similar symptoms. The process typically includes detailed clinical interviews about eating patterns, weight history, energy levels, and impact on work and family responsibilities. Laboratory examinations and metabolic testing help establish GLP-1 deficiency severity and rule out medical conditions that can mimic symptoms such as thyroid disorders, Cushing's syndrome, or medication side effects. Many people feel relieved during the diagnostic process because it validates their experiences and provides a clear path forward for treatment. Healthcare providers emphasize the collaborative nature of diagnosis, encouraging patients to openly discuss all symptoms without fear of judgment. The diagnostic process also identifies any co-occurring conditions like cardiovascular disease, sleep apnea, or depression, which affects treatment planning and approach. Modern diagnostic frameworks recognize the complexity of metabolic presentations and focus on functional improvement rather than weight loss alone. This comprehensive approach ensures that treatment addresses all aspects of the condition and maximizes the likelihood of successful recovery. Questions to get the best treatment and outcome. Engaging actively with healthcare providers through thoughtful questions ensures optimal treatment outcomes and builds collaborative therapeutic relationships. Essential questions include asking about different GLP-1 medication options available, expected timelines for improvement, and specific criteria for measuring progress. Inquire about combination treatments, such as lifestyle interventions plus medications, and whether newer formulations like oral semaglutide might be appropriate for your specific situation. Discuss potential side effects of recommended treatments, strategies for managing them, and what to do if initial treatments don't provide sufficient relief. Ask about lifestyle modifications that can enhance treatment effectiveness, including dietary approaches, exercise programs, and stress management techniques. Understanding the provider's experience with your specific type of metabolic dysfunction and their approach to treatment planning helps build confidence in the therapeutic process. Important questions also include discussing warning signs that would require immediate medical attention, how to access care between appointments, and involving family members or support persons in treatment. Ask about long-term prognosis, strategies for preventing relapse, insurance coverage options, and transitioning from active treatment to maintenance care. Request specific success rate percentages for recommended treatments, and ask about clinical trials if standard treatments aren't effective. Medications and their effects. Modern GLP-1 medications offer effective symptom relief with improved safety profiles compared to earlier treatments. First-line medications like semaglutide and liraglutide remain primary treatments, typically requiring 4 to 8 weeks for initial effectiveness while producing fewer side effects than older weight loss medications. These medications work by mimicking natural GLP-1 hormone to regulate blood sugar, slow gastric emptying, and reduce appetite through central nervous system pathways. Newer medications show promise for enhanced outcomes with broader applications. Next-generation treatments, including tirzepatide, induce 22.5% average weight loss and are more rapid in onset, avoiding the plateau effects that previously limited long-term success. Experimental medications like retatrutide may be prescribed for severe cases while longer-term data accumulates, though these require careful monitoring to prevent gastrointestinal and cardiovascular risks. Medication effectiveness varies significantly between individuals, often requiring adjustments in dosage or switching between different options to find optimal results. Most people experience substantial improvement within 8 to 12 weeks of starting appropriate medication. Side effects, when they occur, are typically mild and temporary, including nausea, vomiting, and gastrointestinal upset that resolve as the body adjusts to treatment or with supportive measures. Holistic and complementary approaches. Integrative treatment approaches, combining conventional medicine with evidence-based complementary therapies, show enhanced effectiveness for GLP-1 optimization. Recent studies prove that specific dietary interventions can naturally increase GLP-1 secretion by 30 to 50%. Regular high-protein meals, particularly those containing 20 to 30 grams of protein, produce powerful GLP-1 stimulation by activating intestinal L cells that synthesize the hormone. Intermittent fasting and time-restricted eating provide practical tools for optimizing natural GLP-1 production while building long-term metabolic resilience. Exercise, particularly resistance training and high-intensity interval training, shows significant benefits for insulin sensitivity and hormone regulation when combined with conventional treatments. Dietary modifications, including Mediterranean diet adoption and omega-3 fatty acid supplementation, support overall metabolic health and may enhance treatment effectiveness. Stress management approaches have proven incredibly effective in providing cortisol reduction and sleep improvement benefits that people often need for comprehensive metabolic healing. These approaches recognize that healing encompasses the whole person, not just symptom reduction. The combination of traditional and complementary treatments often produces better outcomes than either approach alone, offering multiple pathways to recovery and long-term wellness. OTC items that can be of help. Several over-the-counter supplements and products can provide supportive benefits for GLP-1 optimization when used alongside professional treatment. Berberine supplements help improve insulin sensitivity and glucose metabolism, particularly beneficial for people experiencing blood sugar fluctuations. Chromium and alpha-lipoic acid support glucose uptake and may reduce insulin resistance associated with GLP-1 deficiency. Green tea extract and ECCG show promise for weight management support through natural thermogenesis activation. Research suggests that fiber supplements, particularly psyllium husk and glucomannan, play a direct role in GLP-1 stimulation through gut microbiome modulation, supporting the use of targeted prebiotic interventions. Omega-3 fatty acids have anti-inflammatory effects for some people, though these should be discussed with healthcare providers to avoid interactions with prescription medications. Probiotics containing specific strains like lactobacillus and bifidobacterium can provide immediate gut health benefits during metabolic restoration. These supportive measures work best as part of comprehensive treatment plans rather than standalone solutions. Self-help strategies. Empowering self-help strategies provide immediate tools for managing GLP-1 deficiency while building long-term resilience and recovery skills. Meal timing optimization quickly improves hormone regulation and can be used to enhance natural GLP-1 secretion. Protein prioritization techniques help identify and maintain satiety signals that often become dysregulated with metabolic dysfunction. Mindful eating techniques include chewing slowly and eating without distractions that bring immediate appetite awareness. Creating structured meal routines provides stability and predictability that reduces blood sugar fluctuations and food cravings. Regular blood glucose monitoring and food logging support overall metabolic awareness and treatment optimization. Gradual physical activity increases help overcome sedentary patterns that maintain insulin resistance. Keeping symptom and food journals helps identify triggers and successful management strategies for future reference. Building social connections and maintaining meaningful activities prevent isolation and stress eating while providing natural mood enhancement and accountability. These strategies complement professional treatment and provide sustainable tools for long-term GLP-1 deficiency management. Supporting loved ones. Supporting someone with GLP-1 deficiency requires understanding, patience, and knowledge about effective approaches that truly help, rather than inadvertently causing shame or judgment. Listen without criticism, and avoid diet policing or weight commentary, as this minimizes their medical condition and can increase stress eating and treatment resistance. Instead, acknowledge their health challenges and ask how you can best provide support during difficult periods and medication adjustments. Learn about their specific dietary needs and medication schedules, and respect their need for accommodations while encouraging gradual progress rather than dramatic lifestyle overhauls. Offer practical support like healthy meal preparation, exercise companionship, or assistance with medical appointments. Encourage professional treatment while avoiding becoming their primary health advisor or trying to manage their condition yourself. Maintain your own well-being and set healthy boundaries to prevent caregiver burnout and food policing behaviors. Support groups for family members and friends of people with metabolic conditions provide valuable resources and connection with others in similar situations. Celebrate small victories and progress, understanding that recovery is often gradual with ups and downs rather than linear improvement. Prevention strategies. Building resilience and implementing prevention strategies can significantly reduce GLP-1 deficiency risk and prevent symptom recurrence in people with previous episodes. Regular exercise and weight management create a foundation for metabolic health and hormone optimization throughout life. Developing healthy eating patterns early helps people maintain natural GLP-1 function without developing insulin resistance. Maintaining gut microbiome diversity provides natural buffers against inflammatory triggers that can precipitate GLP-1 deficiency. Learning to identify and address early warning signs before they become entrenched prevents the development of chronic metabolic dysfunction and progressive complications. Regular medical checkups and metabolic monitoring help detect problems early when intervention is most effective. Early intervention during adolescence and young adulthood, when many metabolic conditions often begin, can prevent progression to more severe disease. Education about GLP-1 deficiency risk factors helps people recognize early warning signs and seek help promptly. Building strong social support networks enhances stress resilience and reduces inflammatory burden throughout life. These prevention strategies benefit everyone, regardless of family history, by promoting overall wellness and resilience against chronic metabolic conditions.
Subscribe now to join thousands getting reliable health information that improves lives. as knowledge is your best medicine, and we hope you've gained valuable insights from this video series. Make sure to subscribe and like this video. It helps us create even more valuable health tips for you and others. Don't forget to share with anyone who would find this useful. Also, please comment below with any questions or topics you'd like us to cover next. Stay informed, stay healthy,